Dr. Axelrod, welcome.
Thank you. Thank you very much.
I want to hear a little bit about this virtual heart. You and I were already over there kind of learning what it is, but why don't you explain to people what this wonderful project is?
Sure. So we've created a virtual congenital heart disease experience so that you can actually interact with a virtual heart that has a congenital heart defect and then go inside that heart and learn about the anatomy and the physiology of the heart, both the normal heart and abnormal hearts, to see really how they work and to learn and understand about congenital heart defects. So congenital heart disease is one of the most common, it is the most common birth defect. It's also very difficult to understand and be able to visualize those defects inside your head in a 3D image. And so that's why we've created this experience.
I remember in medical school making all these charts, kind of trying to map out where the blood flows, and where was this in my medical school?
You know, we've gotten a lot of that. The biggest compliment some people have given us is, you know, I really wish I'd had that in medical school, or even some people have said, geez, if this had been around 20 years ago, maybe I would have gone to medical school, which is kind of fun to hear that. But in all seriousness, so you know, when I learned congenital heart disease, and the way that usually that we teach it is by complex drawings in a two-dimensional space.
Right, almost like boxes.
Like a box, or even online interactive videos, which we've also produced in the past, that give you a 3D sense of these heart lesions. But it's really difficult to visualize a complex, folded, almost origami-like organ in 3 dimensions, and so that's why we think that VR has an advantage in that way.
So it's a video game of the heart.
It actually is a video game. It comes out of the video gaming software and the video gaming community, and a lot of the technology that we've used, rather than using it for, you know, a game where you fly around as a superhero, you fly around inside the heart.
That's way cooler, of course.
It is way cooler. That, you know, the story that the human body creates in congenital heart disease can actually tell such an amazing story. It is really as compelling as a video game, so that's why we think the medium will really grab the learner.
Who is the target audience of this heart? Is it medical students, physicians, patients, all of the above, lay people? Yeah,
so we have really 2 main groups that we're targeting this experience for. The first is for students and trainees. So really, you know, anyone even down to high school or college, if you're learning about the heart, or if you're learning congenital heart disease in medical school or as a trainee. Those are the groups that we're really targeting for the education and training standpoint. I'd love to see it be in science museums. I think that would be a really cool feature.
They sometimes have those hearts you can walk through, at least the one in Philadelphia. I know they have
that. Yeah, there's one in Philadelphia, there's one in Chicago as well, and those are really fun and exciting.
Right.
The second group is for patients and families, and so when I see patients in the clinic that need to have a heart surgery to repair a congenital heart defect, you know, we do our best, and we usually draw on the whiteboard or draw on a piece of paper what the heart defect is and what the surgery will do to help to correct that. And those parents hold on to those drawings, or they take a picture of it and hold on to that for years, so that they actually understand, you know, what's going on. They can tell people what the heart defect was. But we think that if we can introduce this to them, that they'll have, we hope, a better understanding, and they'll actually be able then to progress with their cardiac care in a better way because they understand.
Increase compliance in some ways?
We hope so. That's still to be determined, but I think it is really important, especially now, to empower our patients and our families to learn and understand you know, what's going on with their health, and this is a part of that.
And through your software, kids or adults can actually even pretend to be the surgeon and fix their heart defect, which I think is just so fantastic.
Yeah, so we can teach them really kind of simplified, schematized surgery so that they can understand this is kind of what vessels are going to be moved in the surgery, this is where the patch is going to go. We're not looking to make it a surgical simulator to actually train surgeons, but more to explain people the concepts of these surgeries that are sometimes hard to understand in 2D.
So as a cardiologist, you're certainly focused in the chest region, but are there, you know, what's next? Are we going to be able to tour virtually through the colon, facial muscles? What can we expect?
Yeah, so I think as the technology advances, and as I think learners will begin to really demand this kind of immersive and interactive education, we're going to be working harder to expand this. So into the adult heart problems, into the lung, into the brain, into many of the organs, especially the ones that are a little bit harder to understand in a 3-dimensional concept. So I think there's a lot of potential for what we could build out, and there are a number of people that are looking at different ways to change education that way, and we're excited to be part of that group.
as a data conference, I feel it would behoove me to ask, have we collected any data on the impact of this, either as an educational model or as a model for patient education?
Yeah, that's a great question, and we have. So we have a group here of physician's assistant students that are in the dean's office in the medical school, and one of our colleagues in the dean's office actually put that group through our virtual heart and tested them before and afterwards to see, are people actually able to learn, heart anatomy and physiology was the first aspect of the test, and they actually show that they could, that you can actually teach people. So that's effective.
Were they randomized to the group
Not
versus,
not randomized,
okay.
yeah. We're working on randomizing in the future as well, to have a group that will do just the VR versus a group that does kind of the standard way. It's a little hard to find people that won't do the VR, because everybody kind of wants to try it. But it is important to show that we actually can teach this information. That it's I would hope that it's better than the old methods to teach. We know that when the students that have gone through it that we've studied, they prefer this method to 2D models, online videos, even cadavers, because it's more interactive and more immersive.
Right.
But we're really working very hard to actually prove that this is as effective as the old teaching method.
Are you trying to replace it or adjuvant, added on?
I think that there are some parts of the education that are such a rite of passage, and in particular I'm thinking about the cadaver dissections in medical school.
Who could forget their cadaver?
Yeah, right.
Yeah.
I mean, I don't think that that's something that we're looking to replace. But I think there are some things that you can really only do in a cadaver. But as far as an immersive, moving, living organ that you can actually be inside, I think that's a great supplement to the way that we currently teach and learn.
I have to say, I'm very jealous of those students.
I know.
Thank you so much for joining me today.
Thank you. It's been a pleasure.